In non-cardiac surgery involving cardiopulmonary bypass, which of the following is a key concern during the management of the patient's temperature? A. Avoiding excessive cooling to prevent coagulopathy. B. Ensuring that body temperature does not exceed 37 degrees Celsius. C. Preventing hyperthermia to avoid increased bleeding risk. D. Maintaining a temperature of 37 degrees Celsius throughout the procedure. Answer: A. Avoiding excessive cooling to prevent coagulopathy. Explanation: excessive cooling during cardiopulmonary bypass can lead to coagulopathy, which increases the risk of bleeding during and after surgery. Cooling is typically employed for organ protection, but extreme hypothermia can impair the clotting cascade and platelet function, leading to complications and blood loss. Careful temperature management is necessary to balance the benefits of hypothermia with the risks of coagulopathy. What is the primary purpose of using a venous reservoir in the cardiopulmonary bypass circuit during non-cardiac surgery? A. To reduce blood volume loss during the procedure. B. To collect and store oxygenated blood for future use. C. To prevent air embolism and maintain a smooth flow of blood. D. To enhance the efficiency of the oxygenator. Answer: C. To prevent air embolism and maintain a smooth flow of blood. Explanation: the venous reservoir in the cardiopulmonary bypass circuit acts as a collection space for blood returning from the body. It helps maintain a steady flow of blood into the bypass circuit and prevents air embolism by ensuring that only liquid blood is pumped through the system. The reservoir also allows for easy monitoring and adjustment of the patient's blood volume. Which of the following complications is most commonly associated with prolonged cardiopulmonary bypass in non-cardiac surgeries? A. Hypoglycemia. B. Cerebral ischemia. C. Hyperkalemia. D. Acute lung injury. Answer: B. Cerebral ischemia. Explanation: prolonged cardiopulmonary bypass can lead to cerebral ischemia due to insufficient cerebral perfusion during the bypass. This can cause long-term neurological deficits and increase the risk of stroke. Proper management of perfusion pressure and flow rates during bypass is critical to ensuring adequate blood supply to the brain and reducing the risk of cerebral ischemia. Which of the following is the primary method for preventing clot formation during cardiopulmonary bypass in non-cardiac surgery? A. Administration of heparin. B. Use of low molecular weight heparin. C. Blood volume expansion. D. Continuous monitoring of platelet function. Answer: A. Administration of heparin. Explanation: heparin is the most commonly used anticoagulant during cardiopulmonary bypass to prevent clot formation in the bypass circuit. It works by inhibiting thrombin and other clotting factors, thereby preventing blood clots from forming within the circuit. The dose of heparin is carefully monitored, and its effects are reversed after bypass to prevent excessive bleeding during the surgical procedure. In a non-cardiac procedure, when using cardiopulmonary bypass, the decision to stop bypass and restore the patient's circulation depends on which of the following factors? A. The patient's temperature and electrolyte levels. B. The surgeon's assessment of the surgical site. C. The function of the bypass machine and oxygenator. D. The patient's response to anesthetic agents. Answer: C. The function of the bypass machine and oxygenator. Explanation: the decision to stop cardiopulmonary bypass and restore the patient's circulation is primarily based on the function of the bypass machine and oxygenator. These devices must be functioning properly to ensure adequate oxygenation and perfusion during surgery. If the circuit is working effectively and the surgical procedure is completed, bypass can be safely terminated and the patient's circulation restored. Which of the following is a known benefit of using a membrane oxygenator during cardiopulmonary bypass in non-cardiac surgery? A. It has a higher resistance to clot formation compared to bubble oxygenators. B. It provides more efficient oxygenation at lower blood flow rates. C. It eliminates the need for anticoagulation. D. It reduces the need for hemodynamic monitoring during surgery. Answer: B. It provides more efficient oxygenation at lower blood flow rates. Explanation: membrane oxygenators are more efficient at oxygenating blood, even at lower flow rates, compared to bubble oxygenators. This allows for more precise control of blood flow during cardiopulmonary bypass. Membrane oxygenators have a larger surface area for gas exchange and provide better oxygenation while reducing the risks associated with bubble formation in the blood, which can cause embolism. In patients undergoing cardiopulmonary bypass for non-cardiac procedures, which of the following factors can increase the risk of postoperative infection? A. Use of pulsatile flow. B. Duration of the bypass. C. Hemodilution during bypass. D. Administration of antibiotics before surgery. Answer: B. Duration of the bypass. Explanation: prolonged cardiopulmonary bypass can increase the risk of postoperative infection. The longer the duration of the bypass, the greater the exposure of blood to foreign surfaces, e.g., in the bypass circuit, and the increased risk of bacterial colonization or biofilm formation. Longer bypass times are also associated with increased inflammatory responses that can compromise immune function and wound healing. How can the risk of neurological injury be minimized during non-cardiac surgery using cardiopulmonary bypass? A. By maintaining low blood pressure during bypass. B. By using high flow rates in the bypass circuit. C. By keeping the patient at normothermic levels. D. By using selective cerebral perfusion techniques. Answer: D. By using selective cerebral perfusion techniques. Explanation: selective cerebral perfusion techniques involve directing blood flow preferentially to the brain during cardiopulmonary bypass, which helps maintain cerebral oxygenation and reduce the risk of neurological injury, such as stroke. This approach is particularly beneficial in high-risk surgeries or in patients who are susceptible to cerebral ischemia during bypass. What is the main advantage of using a roller pump in cardiopulmonary bypass during non-cardiac surgery? A. It provides a more gentle and stable flow. B. It is less likely to cause hemolysis compared to centrifugal pumps. C. It is more cost-effective. D. It is better suited for low-flow bypass procedures. Answer: C. It is more cost-effective. Explanation: roller pumps are generally more cost-effective compared to centrifugal pumps. While centrifugal pumps are preferred for their smooth flow characteristics and lower hemolysis risk, roller pumps are still widely used due to their lower cost and reliability. They work by mechanically compressing tubing to push blood through the bypass circuit, providing the necessary flow during surgery. In non-cardiac surgery involving cardiopulmonary bypass, why is it important to closely monitor the patient's hematocrit during surgery? A. To adjust the anticoagulation levels. B. To ensure adequate oxygen delivery to tissues. C. To prevent excess hemodilution. D. To determine the appropriate blood flow rates in the circuit. Answer: B. To ensure adequate oxygen delivery to tissues. Explanation: monitoring the patient's hematocrit is important during cardiopulmonary bypass to ensure adequate oxygen delivery to tissues. Hematocrit levels reflect the concentration of red blood cells in the blood, which are critical for oxygen transport. Hemodilution during bypass can decrease hematocrit, reducing the blood's oxygen carrying capacity. Adjusting blood volume and hematocrit is necessary to maintain adequate oxygenation.